Today, I'm going to share with you 3 incredibly simple exercises that can make a real difference in your sex life, helping to improve your erections and naturally boost your sexual performance. And especially, the last exercise, I'm quite certain many of you have never heard of it, might just be the golden key to reclaiming your confidence as a man in middle age. Hello gentlemen, I'm Grace. Today, I'll be sharing practical, scientific, and trustworthy insights to help older men stay healthy, live proactively, and continue enjoying life to the fullest. But before we get into the exercises, let's take a quick look at the physiology behind erections. As you may already know, the ability to get and maintain an erection isn't just about desire or emotions. First and foremost, it's a matter of blood flow. In other words, blood must be pumped to the penis at the right speed and pressure to create a strong, lasting erection. But that's not all. Erections are also influenced by the nervous system, hormones, mental state, and emotional well-being. Everything works together, and only when your blood flows well can everything else fall into place. How does blood reach the penis? It's a sophisticated journey through branches of arteries that originate from the internal iliac artery, which itself stems from the abdominal aorta. From there, blood continues through the internal pudendal artery, then branches out into smaller vessels such as the cavernosal artery, dorsal artery, and others that deliver oxygen-rich blood directly to the erectile tissues. Understanding this process not only helps us appreciate our bodies more, but also reveals this truth: if your blood vessels are healthy, your erections will be too. That's exactly why, for men with erectile issues, doctors often prescribe vasodilators like tadalafil or sildenafil, because these drugs help dilate the blood vessels, increasing blood flow to that area. And just like medication, the exercises I'm about to share will also improve blood flow, but in a completely natural, safe way that benefits your entire health. And the best part? You can start today, right at home, with a simple, discreet, and surprisingly effective exercise. The first exercise I want to introduce is the pelvic floor muscle exercise, commonly known as Kegels for men. This method focuses on training the pelvic floor muscles, a small group of muscles located deep within the pelvis, but which play a crucial role in both sexual function and urinary control. What's surprising is that the pelvic floor muscles don't just help maintain erection and control ejaculation. They also have a direct impact on urinary and bowel control. When these muscles become weak, you may experience urinary leakage, premature ejaculation, or an inability to maintain an erection as desired. And in those cases, you simply need to learn how to contract, hold, and release the correct muscle group. But first, you have to identify where that muscle is. A simple trick is, next time you're urinating, try to stop the stream halfway. The muscle you use to do that is your pelvic floor muscle, and that's the one you'll need to train. Once you've identified the correct muscle, you can begin the exercise. Contract the muscle for 5 seconds, then relax for 5 seconds. Repeat this 10 times per set, and perform 2 to 3 sets per day, consistently for at least 6 weeks. This is a clinically proven method that can significantly improve erectile function and ejaculation control, especially effective for older men. Of course, if you have access, consulting a pelvic floor physical therapist can help you do it correctly, particularly if you're already experiencing symptoms like urinary leakage, pelvic pain, or frequent nighttime urination. Exercise 2. Vacuum therapy, restoring manhood through negative pressure. There's another method that's not widely known but actually delivers remarkably effective results. Penile vacuum therapy, also known simply as vacuum therapy. This technique uses a device called a vacuum pump, a cylindrical tube placed around the penis, which creates negative pressure to draw blood into the corpora cavernosa, thereby triggering an erection in a mechanical yet completely natural way. This method has been widely used in treatment protocols for erectile dysfunction, not just for those recovering from prostate surgery, but for anyone struggling to maintain an erection. The device is easy to find and can be purchased online, with 2 main types available, automatic and manual. Among them, The automatic type is generally recommended because it's easier to use and safer, especially for older adults. However, this is not a device you should purchase randomly. Before making a decision, I recommend consulting a pelvic floor therapy specialist who can help you choose the right model based on your physical condition, treatment goals, and most importantly, prevent you from wasting money on ineffective devices. Mechanism-wise, this device works by creating suction around the penis. That suction draws blood forcefully into the erectile tissue, helping to induce and maintain an erection. Typically, this process lasts 10 to 15 minutes per use. Once the desired erection is achieved, a silicone ring can be placed at the base of the penis to retain the blood, prolonging the erection even after removing the device. But the most important thing to remember is this. This is a physical device acting directly on a sensitive organ, so it must be used under professional guidance, at least the first time. If misused, for example, setting the pressure too high or wearing the silicone ring for too long, you risk serious complications such as pain, localized ischemia, restricted blood flow, or even tissue necrosis. These are real risks, not to be taken lightly. As for frequency, vacuum therapy can be applied 2 to 3 times per week, and in some cases, even daily, but each session should not exceed 15 to 30 minutes to avoid tissue damage. Consistency and proper use are what lead to visible results. Most notably, studies have shown that when this therapy is combined with vasodilator drugs such as tadalafil, the recovery of sexual function is significantly enhanced compared to using medication alone. This proves one thing: the combination of technology and medical knowledge can help older men regain their sexual function more safely and naturally than ever before. And the third exercise in today's regimen is the use of a penile extender device. This is a tool that may not be common in everyday life, but is in fact frequently used by physical therapists and specialists in treatment protocols for erectile dysfunction, especially after prostate surgery. Additionally, it also appears in some penile length enhancement programs and is used to help improve blood circulation in the genital area. This might be the first time you've heard the name, or maybe you've seen it somewhere online, thought about it but then hesitated because of fear, doubt, or uncertainty. I once treated a patient named Robert, 67 years old, who came to see me after undergoing a prostatectomy. He admitted that what left him feeling most disheartened wasn't the surgical wound, but rather the sense that he had lost the feeling of being a whole man. The feeling of helplessness, of losing control, of being disconnected from his partner, had caused Robert to nearly shut himself off completely from the outside world. We started with a simple but comprehensive regimen: pelvic floor exercises, vacuum therapy, and, most notably, the penile extender, a device Robert had never considered before. After taking measurements, we adjusted the traction force and wearing duration to match his physical condition and treatment goals. We began with 30 minutes a day, gradually increasing over time. After about 3 months, Robert returned to the clinic with a completely different smile. For the first time in a long while, I feel like I'm in control again, and my wife noticed too, he said. Robert's story is not an exception, it's a testament to the power of consistency and the right choices. Although this device is easy to find online, don't mistake it for a one-size-fits-all solution. The penile extender requires customization, from size, length, to traction force, all of which need to be adjusted according to clinically researched protocols to ensure both safety and effectiveness. Incorrect use can lead to tissue damage, pain, or even ischemia or necrosis if excessive traction is applied. Studies show that when used correctly and consistently for 1 to 2 hours per day, for a minimum of 3 to 6 months, a penile extender can significantly improve sexual function, maintain and prolong erections, increase blood flow to the corpus cavernosum, and in many cases, safely and controllably contribute to penile lengthening. But don't expect miracles in just a few days. The effectiveness of this method requires persistence, discipline, and a clear understanding of your own body. This isn't a quick fix, it's a serious regimen. And if you're truly looking for a real opportunity to regain your confidence, your masculinity, and your sense of control over your body, then the penile extender may be the missing piece you've been overlooking all along. Aging doesn't mean we have to shrink into ourselves. Living long is a blessing, but living long while still being in control, still feeling confident, still knowing how to love and be loved, that's the real reward. Even if the body slows down, even if the hair turns gray and the eyes grow dim, your heart can still be at peace. You can still live fully in every moment, if you care for yourself with knowledge, with intention, and with compassion. These 3 exercises today are a powerful place to start. When you practice pelvic floor training, combine it with vacuum therapy and use a penile extender the right way. You're not just restoring sexual function, you're reclaiming ownership over your body, your mindset, and your self-respect. If you found today's video helpful, please hit like, and share your questions or experiences in the comments, because what you say might speak for countless other men who haven't yet found the courage to speak up. And don't forget to subscribe to the channel. I'll keep sharing practical, honest guidance to help you live strong, live intentionally, and live fully, at any age. Thank you for watching, and thank you for choosing to live for yourself.